inundated with cash.
Good afternoon, everyone. I'd like to call the December 15th Health and Human Services Board to order. Roll call, please.
Kathy Leaf. Present. Kara Koch. Present. Dave Osmus.
Present.
Scotty Yard is excused. Greg Telejohn.
Present.
Paulette Anderson.
Present.
Deb Lindeman.
Present.
Natasha Ward.
Present.
Paul McGinnis.
Present. Thank you. We have a quorum. Moving on. Everyone's had a chance to look at our previous minutes. Are there any additions or corrections? Seeing none, those will stand as written. We have one individual that would like to make public comment at this time, John Strom.
Thank you, Mr. Chair. My name is John Strom. I live in the town of Forest, St. Croix County, Wisconsin. My topic is industrial wind turbines. The last couple of meetings had a lot of discussion around the Highland Wind Farm project, owners, affiliates, and legal team. While this is very exciting news, I cannot help wondering when the other shoe might drop. There is still more than half of the time left on the land leases. What might the lease owners do with these leases? What can we do in the meantime? This has been a significant effort against a large corporation and its affiliates. The town of Forest has been fighting the wind turbine project since 2008, and this has been a major effort for the town and its residents since 2008. It is exciting to think the worst might be over. Supervisor Ard has on her Facebook page a posting of the information from the corporation that used to own the Highland Wind Project. The corporation has now given up all rights to the project. This has been a major victory for everyone who has fought since 2008 to stop this project. Thank you.
And thank you, John. Paulette.
Just so you know, Brenda Salseg of the town of Forest did send an email of a public comment. I'm not allowed to read these now, and it's about the conditional use permit approval of Board of Adjustment on the solar LLC, and I'll enter it.
Thank you. Anyone else wishing to make public comment? Last time, anyone else wishing to make public comment? Seeing none, we'll start our business items, and before we get going with COVID, I will let the board know it is the chair's intention that I am going to try to get everyone out of here by 6:15 at the very latest due to weather conditions, and out of respect to each of you and staff that are here, you can get home in a safely and timely manner. So we'll move right on with item number 1, our COVID update. Kelly, you've got a young man that's going to be with you today.
I do. We thought, thank you, board, for having us. Of course, as always, we thought you might like to hear from one of our critical partners through this last, we're almost on 2 years now. We have invited Steve Massey, who is the CEO for Westfield's Hospital, to give kind of a perspective from the hospital journey. So I will, and Steve, is it CEO or is it president? I probably have your title wrong.
As president, but I like the young man introduction. We could just stick with that.
Yeah, we could stick with that too. Well, I'll turn it over to Steve, and thank you so much, Steve, for giving your perspective.
Yeah, thanks. I appreciate the board letting me have some time on the agenda, and I'll just jump right in. Like Kelly said, 2 years we've almost come on, and it's been a challenging number of months. But over the past several months, COVID-19 infections and hospitalizations have steadily risen in this region. And when I say this region, I really mean both Western Wisconsin and Minnesota. And the high demand for inpatient beds continues to stress all hospitals across this area. And us being part of Health Partners, that's 8 hospitals within our system, and 4 of those hospitals serve St. Croix County. and that's Westfield's Hospital and Clinic, Lakeview Hospital and Stillwater, Hudson Hospital and Clinic, and then Amory Hospital and Clinic. And we've all been very stressed, and it's been a very challenging the last couple months from a space, staffing, supply perspective, with many of our care team working overtime, taking additional shifts, working short, just to keep up with the demand. So I appreciate being here to just address that, just bring people up to speed in terms of exactly what's going on. In light of this, we are actively addressing challenges through the pandemic. We've got incident command structures that are continuing, redirecting focus to caring for the surge of patients and supporting our staff. It's not all COVID, but COVID is a significant contributing factor, with numbers almost as high as they were this time last year when we had that first initial surge that really tested us last year at the end of 2020. Except I think I would say that the nuance this time around is that patients are sicker, they're staying longer in our hospitals, and beds are just less available. The acute beds over in our tertiary hospital, which for us is our partner hospital, that's part of Health Partners and Regions Hospital, they're just not the number of beds to get the really, really sick patients, critical patients over, COVID and non-COVID patients. So I want to also recognize that we've got really dedicated, compassionate care being delivered by our clinical and support teams during this time of stressed resources. And again, these are nurses, doctors, these are people that live in St. Croix County. We're working to enhance our support for our teams as they continue to provide the right care in the right place at the right time. Our hospitals continue to be very full, allowing us to only admit seriously ill and those in need of urgent critical care, surgery, et cetera. We are experiencing staffing constraints. We've got every day, just from a Westfield standpoint, we've got several people are out that they themselves have COVID or on exposure issues where they're not able to work. They're waiting test results. We are to reserve our surgical capacity for patients already in the hospital. We're canceling kind of non-emergent surgical cases, especially those that are requiring inpatient admission. We've kind of suspended our low medical necessity procedures that, again, require an overnight stay. We are able to do a limited amount of outpatient hospital-based surgeries just based on operating room available. We're working to create additional appointments within our primary care and specialty clinic. We're really holding off to make sure that we can make sure that those follow-up inpatient kind of discharge and follow-up ER and urgent care visits can be scheduled. So we're delaying preventative and non-urgent clinic visits. So we are delaying some care from that standpoint. And these are all recent things that were not going on here 2-3 months ago. So these are new things that we're really being challenged with here in the fourth quarter. So again, just, hospitals are here to support the community 24/7. That's our mission. We're here to provide care to all, whether they can, people can pay for the services or not. That's our mission. We're a nonprofit. And we have that commitment and obligation. We take it seriously. We're governed by local community members that are on our board. And again, we're responding to the rising demand. And that's here at Westfield, all across Health Partners, including the Western Wisconsin facilities that serve this region. And we're just nearing the highest demand of patients and hospitalizations with COVID-19 at any point in the pandemic. So I just want to share some numbers with the group here, just so they understand that, over this past week within Health Partners, we've averaged more than 190 patients hospitalized across the 8 hospitals, which is about 90% of our peak from last year at December, almost exactly a year ago. Just from a St. Croix Valley standpoint, that average has been between 40 to 50 inpatients within our 4 hospitals that serve St. Croix County. Just from a Westfield standpoint, we've averaged about 8 patients in the hospital each night that have COVID. So just kind of put that in perspective, which again is about where we were last year. We are on pace just from a Health Partner standpoint to have 40% of all deaths from COVID to happen in the last 5 months of 2021. So if you think about it, the pandemic's been going on for almost 2 years, yet almost half of the deaths going to occur within the last 5 months. From an HP standpoint, we've had our single highest day of COVID deaths happen within the last week. And 9 out of those 10 deaths happened were patients that were unvaccinated. So 9 out of the 10 deaths that happened on a single day last week, they were patients that were all unvaccinated. Patients that require ventilator support in our hospitals are unvaccinated by a ratio of 4 to 1. So, out of every 10 patients that are on ventilators, 8 of the 10 are unvaccinated. That's all. That's local data. That's data that's out of our care system. That's not national data. That is local data. What I can tell you right now is that just today we had to ventilate 2 patients in our hospital. The number of patients that we've had to have on vents at Westfield in the last month is more than we've had to have on vents in the last 9 years that I've been here. So I mean, just put that in perspective. The 2 patients that we've had to put on vents today alone are 2 patients that were unvaccinated. So just again, put that in perspective. On the flip side, we've taken the ability for us to deliver vaccinations starting almost a year ago on December 24th, all the way to where we're at today, delivering boosters and making available boosters, both Pfizer and Moderna. We've taken it very seriously. We've delivered over 15,000 vaccines. We just crossed that milestone last week. From a health partner standpoint, if you include all 4 of our organizations serving St. Croix County, we've delivered over 65,000 vaccinations in almost a year. We've got a monoclonal antibody clinic, which is a treatment option for early treatment for COVID. The demand is outpacing our capacity, but yet we're still pushing ourselves to try to open up capacity as much as we can, and we're working really quick to work with the state to try to bring, once final approval from the FDA comes to light, additional treatment options with the oral medications that are being reviewed by the FDA now for people to have access to that just as another treatment option with the idea to keep people out of the hospital. So again, like I said, just today, 2 patients that were needed to be vented here at Westfield, both unvaccinated, and both of them are between the ages of 55 and 60. We're seeing patients that are on vents in their 20s, 30s, and 40s at Regions. No significant underlying health conditions outside of being obese. And I'm not talking about morbidly obese. I'm talking about BMIs in 30s, 35 BMI levels. And unfortunately, I'm in that category, my BMI. And so again, these are not people that are morbidly obese or 500 pounds. So again, just I think those are good things just to think about, put things in perspective. So this is reality. I don't feel like there's an awareness in the community. I talk to community members. I don't think people realize just how bad it has gotten and how bad it is. In the last week, we've seen 3 people die here at Westfield of COVID, and another 6 people transferred out since the start of the month that were in really bad shape. And so this is a reality of where things are at. I think Kelly understands things from a broader county standpoint, but we're on calls with the other hospital leaders, both health partners and non-health partner hospitals in the region, both Polk, Pierce, and St. Croix County, and they're dealing with the same types of challenges that we're dealing with here at Westfield. So what else does it mean? I can tell you that the pandemic and challenges our experiencers are not over. And even though they took a little bit of a dip over the summer, they are back with a strength that we weren't expecting. So it's important for this group to hear that just from a local healthcare leader. So I appreciate being here. What does it mean? It means we're delaying care that we would normally not delay. So if you're wanting to get a physical, or if you're wanting to get a year-ending, knee replacement, if you're wanting to get a surgery that you've been holding off on, that's not a surgery that is, considered elective, you're not going to be able to get that because we're delaying some of the. So again, these are things that we would not routinely do, but in the face of the pandemic, we're being forced to. Wait times are significantly up in urgent care, emergency room settings. We are averaging twice as number of inpatients that we would normally have pre-pandemic. So we're seeing that many more people in the hospital. Again, not all of them are COVID. About half of the patients in our hospital on any given day have COVID. The other half do not. So we're just busy in general, and COVID is just a contributing factor. So again, and the patients that we have in the hospital, the sickest that we've ever cared for in the 10 years that I've been here, we are really challenging our nurses and doctors to practice at the height of their training. And again, I'm so fortunate that we train our teams through simulations and education to be able to care for patients in emergencies that we don't routinely do, because they are being tested on that. Like I said, we have 2 vented patients today at the same time, and that is not the norm. Normally when patients are that sick, we get them to Regions. And unfortunately today, we're having to take care of those patients because there are not beds available at Regions or any other tertiary hospitals in the Twin Cities. Matter of fact, just last week, we had a call with another hospital president who had said they personally were calling hospitals in all the states, North Dakota, South Dakota, to try to get a patient transferred to hospitals, 2 states away. Because this was a patient who was critical and needed to be transported out. And so that, again, that's the reality of what we're dealing with. This is, like I said, this isn't unique to Westfield or health partners. I talked to my colleagues from other hospitals across the region. We're all dealing with these challenges, some even worse because they're not affiliated with a larger organization. We have that connection and working relationship with regions. So again, we're in a much better shape. So at the end of the day, with the rate of the spread in the community and the potential risk with the Omicron variant, I continue to advocate the following actions, which again will continue to help. And it's nothing new that none of us have already heard before. But just to reiterate, we talk about it here with our own staff, with patients, family members. Get vaccinated. Anyone 18 and plus should get scheduled for a booster. It's recommended by CDC. Wear masks, social distance, and practice other mitigation efforts as recommended by the CDC. And the big thing, I was able to participate in like a forum within health partners. We've got 24,000 employees, and so I did kind of a roundtable WebEx for people to log into. And one of the things I talked about personally is because I'm an individual. About 6 weeks ago, I had COVID. I had received both my vaccines early on, and I was in line to get a booster. And before I could get my booster shot, I ended up getting COVID. I went in. I benefited from getting monoclonal antibodies as an early treatment to help with the symptoms. But at the end of the day, what I tell people is that there's a group of people that are not happy about the mandates, and we hear it here from even employees that colleagues at work at Westfield. And I think there's this feeling that mandates and vaccine efficacy are somehow tied together, and they're not. You can not like a mandate, but you can still believe that the vaccine works. And that's even where I'm at partly, that of the vaccines work. The numbers I show you in terms of when 80% of the deaths and 80% of the people on ventilators are people that are unvaccinated. That right there shows you that vaccines are keeping people from having the severe impact of COVID. So vaccines are keeping people off vents and keeping people from dying. And that is what, the benefit of and the efficacy of vaccines. And so when we talk about why get vaccines, it's going to keep people out of the hospital. It's going to keep people from dying. And it may not keep you from getting COVID, which in my case it didn't. But again, it kept me from having to be hospitalized. It kept me from having, to have severe symptoms related to my COVID. So that's where I talk to people. It's like, don't confuse it to, you may not like mandates, whether it's federal, state, employer-based, I've heard it all. But don't confuse that with the efficacy of the vaccines. And again, that's kind of the position I've taken in some of the communication and conversation I've had with my colleagues and community members. And so again, I just really appreciate the time as to really provide a more up-to-date and real-time update of what's happening on the ground here at a local hospital serving St. Croix County and specifically the New Richmond and surrounding area. So with that, I'll turn it back to Kelly, and I'll stand in case there's any questions from the group.
Thank you so much, Steve. I know you're running tight with your schedule today. Are there any questions for Steve?
Questions or comments? Dr. McGinnis.
Yeah, Steve, just one quick question. In the past, we've heard that problems with not having enough staff have limited the capacity of the hospital to provide for inpatient care. Is that still the condition you're seeing, or have you been able to make some adjustments that are still providing plenty of access, that it's not just limited by staffing, it's really being limited by the volume of patients?
Yeah, I would say that staffing is, there are some constraints with staffing. I think we've made some adjustments, at least, both with the health partners as well as we talk to some other hospitals and talk, with my peers. For instance, we changed our documentation standards to fall in line with pandemic operations. So we're able to do less documentation so we can stretch our staff, further so they can do more and spend more time with the patients. We've increased our staffing ratios. So instead of caring for 1 to 4 from a nursing standpoint, they can go to 1 to 6 because we're able to bring kind of team-based care delivery. So they've got some more support staff. We're using some televideo support from resources at Regions to kind of push ourselves to take more patients out here. Again, space is some of the limitations, some supply stuff, but I think it's just the overall patient demand and the fact that we're caring for much sicker people this time around than we were a year ago. And those patients are staying much longer. We've gotten better in terms of treating COVID. And so these patients that are on ventilators are staying much longer, especially even those that unfortunately are dying, they're staying much longer on ventilators before they do end up dying. So it's really stretching the capacity of both the tertiary hospitals as well as the referral hospitals that just aren't used to taking care of this level of acuity of patients. They're used to getting them transferred out and doing it very effectively, but just they're not able to do that. But again, staffing is a concern. We with a pandemic, we have seen a lot of early retirements. In all professions, people that have had whether it's health concerns that they have where they just decided they don't want to work anymore, the stressors of working during the pandemic. It's the great resignation, right? It's a term that has been used not just in the healthcare industry, but other industries where people are resigning and deciding not to work, and it's impacting the healthcare profession as well as under other industries. And so it is impacting it, but that's not the only challenge that we're dealing with.
Anyone else? Kathy?
So I know in Minnesota, they've been using the National Guard medics in some cases. Is that being talked about here?
Yeah, so, in Minnesota, they've done some work bringing in both the National Guard and some federal resources. They've been able to get some federal resources allocated to a couple of different health systems. I know Health Partners is right now working on an application to get the Federal Medical Corps to come in and help at a couple sites as well. Just, the Wisconsin from a state standpoint has not done that. We have been in discussions with the Wisconsin Hospital Association in terms of how to best request some of those resources at a federal level. Unfortunately, COVID is spiking across the nation, and there's some other states that are even worse off than we are. And so you're talking about a finite resource being now spread across many states. And so, I think, the idea of getting anything, sent to Western Wisconsin is probably slim. But if we can get some of those resources in some of the tertiary care centers, that's going to by default help us because it's going to allow us to get some of those really, really critical patients into those tertiary centers like Regions sooner. And that's going to, really benefit our patients much better.
Anyone else? Dr. McGinnis?
Just one additional comment, Steve. I just want to convey appreciation and thank you to your staff. They're almost 2 years into this event. They're continuing to work extraordinary hours in extremely difficult conditions, oftentimes when they're on the receiving end of some fairly negative input from both their patients and their patients' families. So I just want to recognize them and the very, very hard work that all of the healthcare staff in our county are doing. I think that they are the frontline healthcare workers at this point in the pandemic, have been forgotten and are frequently don't feel very appreciated as they care for those very individuals who are in so desperate need of their help.
Yeah, I appreciate it. Yeah, and again, a large percentage of our workforce lives in St. Croix County, so these are your friends and your neighbors, maybe some of your family members. And so again, these are folks that you're representing within the county. So yeah, I appreciate that feedback.
Took the words right out of my mouth, young doctor. Natasha?
Yeah, I just want to echo that as well. I work at a different local healthcare facility, and it's exactly as Steve represented across all the facilities. And our healthcare staff are absolutely exhausted, and they are doing everything they can, but we really need the community's help right now.
Anyone else? Well, Steve, again, we thank you for taking the time. Great information for all of us. Give our heartfelt thanks to each and every one of our great healthcare workers, if you would. And be safe, and we best wishes and for a warm and blessed Christmas to you and all your staff members. Thank you very much for being here.
All right, thank you. I will pass that on to the team here, and thanks again for having me.
Thanks, Steve.
Kelly?
Okay, just give me 1 second because usually Ellie does this, and Ellie is on a much needed vacation. So you get me, so the data isn't going to be all great bells and whistles, but I have prepared a few slides. I really can't express how creative and innovative the CEOs in St. Croix County are. And as Steve mentioned, Polk County as well as Pierce County. We're meeting with those CEOs weekly. And they really do care about their staff. They care about the patients that they are taking care of. And they really have been an unbelievable great group to work with from a public health standpoint, and coming together and trying to figure out ways to help with bed capacity or creative ideas to get care to the heart attack or the cancer patients. So just want to add that we see that weekly in those calls. So few slides for you guys related to kind of where we are at in December. Well, maybe. There we go. So there was Steve Massey. I'll run through just a little bit of December data, give you an update on testing, and then kind of where we're at with vaccines. Nothing fancy here. This comes right off our St. Croix County dashboard. This was updated yesterday. And remember that when we update, it comes from the day before. So Thursday's data is here. We have our daily 7-day average has dropped a little bit, 73 cases a day, which is much better than the 100 cases we were seeing previously. So very happy about that. This slide was constructed by Ellie for the County Board of Supervisors meeting last week. This is kind of an interesting slide because it really looks across the 2-year period, almost 2-year period. Remember our first case was in March of 2020. So you can kind of see the fluctuations by month, by year. And again, there were only, so if you go all the way to December of 2021, there were only 357 cases that first week. I did the math. I didn't get the slide updated, but in the month of December thus far to date, we have had 1,131 cases. So just over 1,100 cases, and we are on December 15th. So we still have over half the month to go, and my guess is we will surpass last year's December numbers. I did have this school slide in only because Ellie was giving updates. I think it was really important to point out kind of some of the changes, the updates to this slide. You saw this slide last month, and we had that week that we presented, we had 148 cases on November 16th. For a total of almost 1,300 school cases. Now that's across the entire St. Croix County school age, both private and public school. In December of, the first week of December, we had 120 new school cases for a total of almost 1,700 since the beginning of the year. And then this last week, we had 112 cases. So 1,800 cases thus far in St. Croix County schools. Testing, I want to talk a little bit about testing because as Steve mentioned and as Supervisor Leaf asked related about finding some federal resources and hearing about different resources to take care of some of our hospital needs. One of the things in the state of Wisconsin, as I think you all are aware, is the Wisconsin National Guard has been with us almost since the beginning of the response. They started testing missions in May of 2020, and they have continued missions. Their testing missions have continued throughout the response. The state of Wisconsin has indicated to local health departments that resource is likely going to dwindle over the next few weeks and become less available for different communities for testing. So we have at St. Croix County made the tough decision to get into the testing business. We will be starting testing at the St. Croix County Services Center. We have a small team who will be testing, and this will all be updated on our website. We're going to pilot testing, not pilot, we're actually going to be doing testing, but we're going to start this operation pretty slow to see what the demands are. So those testing at the St. Croix County Services Center will be on Monday and Wednesdays. It seems there's quite a need for testing on Mondays, usually after a weekend. We've talked with other health departments who have already engaged in becoming a community testing site, and they say their highest demand is during the first part of the week. So we will start that, and as I said, we will have that updated on our website. This is just a testing site that kind of shows where our percent positive is at in our county. So we are higher than the Wisconsin average, almost at 16%, where the state of Wisconsin is at 13.2%. And vaccines, you heard from Steve, where vaccines, that it is one of the strategies that the hospitals are looking at. Obviously, this has to be, it is our #1 tool, and it is a strategy to combat COVID and decrease variants across the whole entire globe. So again, not a fancy graphic. These graphics can be found on our website. This is where our percentages look like across age categories. I will say, as the 5 to 11-year-olds became eligible for vaccine, the DHS hadn't updated their data, but they announced yesterday that data had been updated. So just yesterday, they started sharing statewide data of 5 to 11-year-olds and their vaccine percentages. So St. Croix County residents 5 to 11, we're at about 18.3% that they've started the series, which is very good news. As I said, we talked to our hospital and clinic partners on the weekly. Many clinics are meeting demands of vaccine by hosting vaccine clinics or certain vaccine specialty clinics. Westfield does that. Hudson Physicians is doing that, and they are seeing the demands for booster shots as well as some of the younger age categories. So all good news. And as always, you can check out our data dashboard. As I said, Ellie's on vacation, much needed one, but we do have somebody updating data in her place. So check it out. Thank you.
Any questions for Kelly? Comments? Dr. McGinnis.
Yeah, thank you. Couple of additional comments. So in addition to the county testing that's going to be ramping up, there's also salivary testing that can be ordered through the Department of Health and Human Services of the state of Wisconsin. And then the at-home tests are now more routinely available in stores. Those are less precise than the other two forms of testing. One quick comment on the booster comment made by Mr. Massey. He mentioned 18 and above. It's actually now 16 and above. That was approved last week. I also want to acknowledge, and we've discussed at Health Partners Hospital, but want to acknowledge Western Wisconsin Health and their efforts in this pandemic as well. Last comment is related to, you heard what the hospital crisis was, so it brings to mind three things. The first thing, short term, is simply using these things. They do work, and they're highly effective in our school settings, they're highly effective in our business settings, they're highly effective in any type of indoor public space. So once again, the more we can do this, the more we're going to take the pressure off those hospitals and allow people who need that desperately, the routine care or the heart attack patient, to get that care. Secondly, vaccinate. If you haven't vaccinated, it's absolutely critical at this point with Omicron coming down the pike, and I think it will be a deal, that now is the time to vaccinate because it takes a minimum of 5 weeks to get protection. And so if you start right now, by the time Omicron gets here, which I'm expecting to be sometime in January or February, you should have some protection and reasonable protection against that. And lastly, if you've not been boosted in any age category 16 and above, it's been 6 months since your vaccination, second vaccination, you absolutely should get boosted. That is showing it for both Moderna and Pfizer to be very, very effective against the Omicron variant for both transmission, although transmission risk is higher, but specifically for hospitalization and for death. And that's where we're seeing that work extremely well. So,
Anyone else? Well, Kelly, thank you again. And we need to thank not only you, but your great staff and all the volunteers that have stepped forward to help you out. They're the best of the best. And again, a hearty and a very warm Merry Christmas to each and every one of you. May you all have great blessings, and keep that four-legged critter of yours, put some mitts on her paws when you're out taking her for a walk, if you don't mind. Thank you. Okay, we'll move on to item number 2, a healthcare campus update. And we've got Sandy on board.
It's been a while since I've been here, so a little bit about our census, and that has to do with the fact that in 2020, almost 2 years ago now, we had COVID come and be our friend. We had a lockdown in long-term care and opened up for visiting in the fall. So we averaged our census last year in 2020, our average was 37. And so far this year, we're averaging 30.8. And I know that the question was brought up whether or not it's a referral issue or a staffing issue. And like everyone else in the area of healthcare and any other business, it's a staffing issue. We are having some issue recruiting like everyone else. So we have made the choice to shut down one of our units, and we are using some of our long-term beds in our one of our neighborhoods for our rehab patients. So a little bit about our workforce. In early 2020, before COVID started, our licensed nurses were at a 10.6 FTE. So that's how many staff we had available for working. And now we have 7.7. That's due to retirement, moving on to a different position, some hospitals, some hospice, that type of thing, for our licensed nurses. Our certified nursing assistants in early 2020 had a 21.06 FTE, and right now we're at 12.82, which is not quite half, but significantly lower than we like it. And that's why we have to be very careful about our admissions and maintaining our staffing at a level that we can maintain quality care. So, does anybody have any questions about staffing or census before I go on?
Any questions?
Okay. So talking a little bit about our vaccine, we have 53 out of 75 staff members that are vaccinated, fully vaccinated, and that is a 71% vaccination rate. Out of those, 40 of them were eligible for the booster, and we've had 20 staff members take the booster so far. I'm really pleased to say that 29 of our 29 residents that we have in-house today are 100% vaccinated. And of the 29, 22 of them have had the booster. So that's fabulous numbers for our very vulnerable public. I'm also very happy to say that at this time, we don't have anybody, staff or residents with COVID. We continue to wear our masks and our goggles, and we continue to work on the vaccine mandate. There is always something new with that. Today, there's more update. It's been reinstated. However, the Department of Quality Assurance Administrator has said they won't be enforcing it until they hear from CMS. So we have been working on the mandate and everything that goes with that for our vaccine for our staff. So more to come with that. Does anybody have any questions about that? I do want to talk a little bit about referrals. I know that Steve said that the hospitals are short, but I do want to tell you, today we received a referral from Chicago. We've received them from South Dakota, Duluth, Janesville, La Crosse. That is how far out people are reaching to find beds. So this is critical as far as the medical profession goes. As we talked about our workforce being in trouble the last couple of years, and it's here. Any questions?
Deb?
Are there any plans or any strategies that can be used or implemented to increase the workforce or do something? I mean, what's the conversation been around that, or is there nothing really that can be done right now?
Well, we actually had some contact, some people that know some people that are in the National Guard here in Richmond. So we were reaching out to see if anybody wanted to be trained as nursing assistants. We have reached out to several agencies, and unfortunately the agencies, up to just this last week, we were able to receive one person from the agency to help us out. They don't even have staff. The state of Wisconsin has contracted with pools, and they're going to take 40% of the burden of the, no, 60% of the burden of the bill, and the facility will be 40%. And we've been contacted twice by that agency that state has contracted with in October and in November, and we received no referrals or no staff from them. Of the 209 facilities that reached out for staff, they have placed 65 people in the state of Wisconsin. That was the last number I heard. So we're being creative. We have been able to reach out to the schools and work on programs with them for work release. And we have made some progress with Orchard View. Oh, I didn't talk about Orchard View. Some progress with Orchard View and our training staff there. But I do want to tell you that Orchard View census today is 31, and it continues to go up. In fact, our first floor currently has one vacancy in a studio and one bedroom available. And our second floor also is, it has 5 units available. So Orchard View has been a great resource for us, especially for some of our rehab people in the nursing home have been moving over there for continued care and services. So Orchard View is doing very, very well in their admissions. So, and their staffing has been staying pretty stable.
Any other questions, comments? Natasha?
Sandy, do you have any retention strategies to try to keep the current staff?
We have, we recently dispersed the COVID, or the ARPA funds to our staff, actually last week. And that was a boost for them. And we have, bonuses to them for referrals. We're trying to get agency staff so they're not working so many hours. There are several of them that pick up. And I think that's important to recognize that has to stop at some point for them to be okay. Because everybody is tired. We're all tired. We all wear masks and goggles, and it'd be nice to be able to see people's faces. We are doing, I'm doing a dinner for them next week where I'm actually bringing them in food from a local restaurant individually. They get to order what they want. So we're doing some of those things. We're doing some scavenger hunts. We're trying to break up the monotony of just doing the same thing every day. So if you have any ideas, please send them my way.
Anyone else? Well, Sandy, I'd like to thank you. You've been very gracious when I walked in the door up there, and we've always had a good conversation. And when it's been quite a while, I suddenly either get a text or an email with a, "What's the matter? Are you mad with us folks up here? Get up here." But I appreciate that. And at this time, the board would like to thank you and the entire staff for all the good work that those folks are doing. We wish you a warm and a blessed Christmas, and please pass that on to everybody. You folks are the best. Thank you very much. With that, we will move on to item number 3. Bob, I'll turn that over to you.
Mr. Chair, I think we're going to discuss this agenda item being postponed because of Supervisor Ard being absent tonight. Is that correct? Or?
Yep. I think as long as Scotty is not here to discuss it, and we've got a lot of information at the end of the afternoon, Bob and I talked a little bit, and we thought it best that we just hold off and bring it back next month when she's here, and we can go through that whole information. Gives you guys all a chance to read the packet. So if you've got any questions, you can let her know. Kathy?
I'm wondering if this is better suited for community development than this committee.
And I would agree with that, too.
Chair of Community Development was wondering that also. So that would be another alternative for you. If you didn't want to hold it over till your next month's agenda, you could refer it over to the other committee.
Yeah, I would refer to community development.
I'm fine with that. I think it should go there first. Yes, second it.
Just respectfully to Supervisor Ard, does she participate in that committee? I don't remember. And would she be able to provide that information to the committee in a fashion that would be useful? I just want to make sure she has her chance because she brought this issue forward. So,
Any other comments? Bob, you got anything extra?
Just that Supervisor Ard provided a couple of documents this morning that were shared with the board. I didn't have a chance to read them today, so I just wanted to make sure you knew that they were shared with you via email, and if you didn't get them for some reason, we can provide those.
Any other discussion? All in favor say aye.
Aye.
Opposed? Motion carried. Thank you. We'll move on to item number 4 with our monthly financials, and Faye is here with us.
So the financials for through November of 2021 are in the packet. Our revenues are on track or a little above where we had budgeted, and also a little above of where we were even last year at this time. The one big number is, public health additional money that we've been receiving for the COVID tracing and other work that the public health staff are doing. When we look at our expense side, we're seeing a few reds, and those are line items where we've gone over the budgeted amount. Software purchased is one of the big ones that was over $60,000. That is the public health software, and we're using ARPA funds to cover that. So we see the expense here. There's money that will come through then the ARPA that will offset that expense. And the other ones are pretty minor, just expenses that came up. I do want to touch base. So children's services on page 23 of the packet. So one of the things we talk about each month is the purchase services expense and children's services. They're over budget, $255,000. What I do want to explain though is, so 1, 2, 3, we have multiple programs in children's services that all show up within this number. So there's birth to 3, child protection, children's long-term support, children's COP, kinship, youth justice, our Youth Justice Innovations Grant, targeted safety support. 2 of the line items, children's COP and children's long-term support, we have had some high dollar expenses, and those are fully funded through the reimbursement. So children's long-term support, normally those providers bill directly to the third-party administrator, but if it's a high dollar expense, so if we do a home modification that was approved by the state, some of our respite care or other providers who are one-time only and just not equipped to do that billing, what happens is we submit the claims to the state for them, and then we get that reimbursement back. The same thing with children's COP. We have a high dollar home modification that we're covering with that, so that expense will show up here, but that will show again in our revenue and be offset. So we do still have some, I looked at kinship compared to our child protection and compared to youth justice, so those would be the out-of-home placement charges. Child protection is actually very similar to what it was last year. Youth justice is a little lower. Our kinship placements are very much up from where they were last year, but that's a good thing. So that's, again, that strategy of as children need to be placed in out-of-home care, they're trying to place them with relatives or someone else compared to a foster care placement. So then we're going to jump to our healthcare campus. We do have some good news here. So for all that Sandy was talking about the struggles that they're facing at the healthcare campus, if you look at that other federal payment line, 43310, that number is $725,000. We did receive $1 million from our Phase 3 application that I submitted. And those are, again, losses that we suffered in 2020. We're now receiving that reimbursement for. We did not put the full amount in revenue. We put half of it in deferred revenue because we have until December of 2022 to use this money. So we're using part of it to cover losses that the healthcare center is having right now, but we also want to be able to have that money available for other expenses that may come up over the next year. We received an additional payment too from part of our Phase 4 application, and this was a rural provider payment that was $343,000. Again, we posted half of that as revenue, and the other half went into deferred revenue. So we'll work with auditors and administration on when would be the appropriate time to use that deferred revenue and what's the best strategy for using that. Overall, so November revenues, this report was run early, it was run December 7th. So November revenues from the healthcare campus have not posted yet. So those are 272,000. Once that number is posted, the campus as a whole will be in the black. Nursing home will still be showing a loss, but Orchard View will be showing a profit. So again, Sandy was saying that Census has continued to grow. So overall, they're doing much better than the nursing home is, although their Medicare numbers are coming up right now. So hopefully with the increased Medicare rate, the increased Medicaid reimbursement, I just saw that family care is going to get a 4% increase as of the first of the year. So hopefully those additional funding sources will help offset those losses. Any questions for me from the financials? Thank you.
Move on to item number 5, addressing the housing needs. Bob.
Thank you, Mr. Chair. The only update I have around housing from my end is included in the ARPA summary that I provided you, and that's in the section under recovery housing, where we've entered into a contract with Onyx, who provides sober housing or recovery housing for individuals with substance use disorders, mental health disorders. We have utilized them, and that is, we provided rental assistance to Onyx already in December. They'll provide us with monthly reports going forward that show us how the money's being used for rental assistance for those with financial need, and as well as capture outcomes measures that we've outlined in our report, our monthly reports. I do not have any other housing updates. Again, with Supervisor Ard not here, I would ask if there are other board members that might have more information about housing.
Greg, do you have any comments, concerns?
Excuse me. I know the area churches are still discussing warming situations. There's a project possibly happening here in Hudson that I heard about with one of the churches, or a couple of churches getting together, that they're working on a temporary warming situation, or overnight situation. And the Methodist churches in the St. Croix County are having ongoing discussions also. So it's getting some traction. So I don't know if anybody reads the county news, or the county newspaper. Is it the national newspaper or whatever? But there's counties that actually purchase hotels too and convert them. You can take it in a smaller scale and, look at that too. So those are other solutions. Quite frankly, I don't know why we're discussing wind turbines and solar panels now, when we should be discussing housing more and moving faster on that. But that's my personal opinion.
Any other comments? Deb.
Why did I hear about a grant that was applied for through public health, maybe for housing issues, or did I dream that? It seems like I remember hearing something about that. I don't know any details though.
Yeah, I'm not familiar with a grant around housing through public health. I would have to ask or get more information, I think.
Okay, I'll check with Kelly. Maybe she mentioned it in the meeting last week, but I thought I heard something about that. I don't know any details, but I'll try to find out.
It's not ringing a bell with me. So.
Okay, sorry.
I think that was with Pierce County, Deb.
Oh, was it
And
with
United
the
Way.
part of the CHIP, part of the?
Yeah.
Okay.
Yep. I think St. Croix County might be included as maybe partner in some way, but I think the main
Okay,
people applying
Okay.
was Pierce County.
that might be what it is, okay.
There was a grant that Pierce County was taking the lead on that we would be a partner of, but as far as our role in that grant, I'm not sure if that's been defined yet.
Oh, was it a United Way grant? Okay.
Any other comments, questions? Seeing none, we'll move on to our final agenda item, the American Rescue Act, Plan Act initiatives. Bob?
Thank you, and I'll just address any questions the board might have from the summary I provided. I would just add one thing to the top, those 3 bullet points that are listed there around posting LTE positions for 5 FTE positions, a lot of acronyms there, for full-time equivalent positions. We have interviews scheduled, or SHAR does with our Behavioral Health Division, has interviews scheduled for this Friday to interview candidates who have applied for those FTE positions. I'm not sure of the total applicant pool. It was around 10, and when I wrote the report, but there were some good candidates in that mix. So our intention would be is if we can hire for 5 positions to fill these, the co-responders with law enforcement, those 2 FTEs, 2 full-time equivalents working in the communities as case managers, care coordinators, and then the other position was to collaborate with Justice Support Services and provide somebody for pretrial, sentencing, early intervention with the criminal justice involved population. If we can hire 5 FTEs as LTEs, limited term employees, we can train them as a group, sort of in a training academy kind of environment, so that they're all working with a similar purpose, with a similar sense of the initiatives that they're being hired for. So they, in other words, they all work together as a team, regardless of where they're positioned in this ARPA funding. The idea here is to design a system, develop a system of crisis care that fills in the gaps that exist currently and supplement the current crisis services that are already offered in St. Croix County. I'll keep you updated on where the hiring is at for those FTEs and where we get after Friday. The 2 peer support specialist positions, we're discussing possibilities with a local agency in New Richmond who may be able to provide that level of care, or those positions, I should say, on some level provide that care. We might not get 2 FTEs from the agency, but we can start with however many people we can get to help with the peer recovery support until we can recruit and continue to recruit for that. Otherwise, I'll just take questions you might have around any of the summary information I put in the report.
Dr. McGinnis.
Sure. As I looked at this, I was very, very interested in the concept of the co-responders with law enforcement for mental health and substance abuse. I think there's some very intriguing information around the utility of mental health experts working with law enforcement experts in cases where we have a patient with severe mental illness. It puts the law enforcement folks into an area that is very uncomfortable and probably not directly within the scope of their training, although they've had additional training at that time. So I think this is tremendously valuable. I'm very interested in hearing a little more about that program as it matures and develops. There are some very exciting programs that are developed in other communities throughout the nation that I think are helping to relieve some of the stress and strain on law enforcement and provide a much better approach for those who are mentally ill and their families that may be, frankly, much more effective. So I'm very interested in that and very thrilled to see that the county's moved in that direction.
And I would just say, Dr. McGinnis, I would just say that we've had discussions with chiefs of police, Sheriff's Department, around how to design this model so that it makes sense to them, as well as from a behavioral health standpoint. The idea, of course, is to respond to those calls with law enforcement and allow the officer to leave if the situation does not appear dangerous in some way to the individual or to the people involved in the response. So we would want to craft this as we go, I think, in a way that makes sense to law enforcement and prevents these folks from, hopefully from devolving into a further crisis from that point. So.
Any other comments, questions? Okay, thank you, Bob. Seeing none, we'll go on to requests for future agenda items. Anybody have any requests? Seeing none, we'll move on to announcements and correspondence. Bob.
I do have a couple of announcements, Mr. Chair. The first is an update on the Civil Rights Plan, 2022 to 2025 Civil Rights Plan. The requirements for the new Civil Rights Plan were released on the 2nd of December. So we've formed a group to respond to the requirements. Really, right now, we're going through what those requirements will mean for us in terms of data collection and other kinds of documents that we'll need to provide. Colleen's been very helpful in organizing a lot of these efforts. But for the immediate future, we'll provide a letter of assurance to the state by the 15th of January that just verifies that we will be developing a plan, which will be due by by early March. Looking through it, I think we're well positioned with the data that we collect or can pull from Avatar and other electronic health records, and through data sets that the state has provided for counties to use in determining some of these responses that we'll have to craft. So I think we're on track. We're fairly well organized for just receiving this information, and we'll get busy on that. The other announcement is much more fun. We completed interviews for the ADRC administrator position that was open due to Brad Beckman's retirement on the 10th. And after first and second interviews with some very impressive candidates, we've chosen Kristin Newton to be our new ADRC administrator. And I just wanted to briefly, for those of you who may not know Kristin, give you a little brief bio on her. But Kristin joins the ADRC team after nearly 20 years of experience working for St. Croix County HHS in various capacities within the Behavioral Health Division. She brings a great deal of experience in serving individuals with complex challenges, in addition to leading a team that straddles multiple systems. Kristin brings strengths in collaboration and networking, relationship building, conflict resolution, and program compliance, and is very excited, and she is very excited for this new opportunity to join and share in the mission of the ADRC. I announced this to HHS staff today, and I will, at your, if you would like, I could invite Kristin to an HHS board meeting so you'd have a chance to meet her and ask her any questions you might come to mind. Those are my announcements, Mr. Chair.
It's a good choice.
Well, since I allotted us until 6:15, I'll take the floor for a little bit. No, I would like to thank this board. It's been a long year for us, to say the least. And I've been blessed to be associated with a great board, very talented folks, very educated folks, and you are all the best of the best. And I wish each of you a very warm and blessed Christmas. Be safe and have great holidays. And with that, our meeting is adjourned. Thank you.